How do doctors close wounds after Mohs skin cancer surgery? When a skin cancer is removed using Mohs surgery, the way the wound is closed depends on its size, location, and depth. The goal is to remove all cancer cells while restoring the skin's appearance and function as much as possible. Doctors have several techniques to achieve this, and they choose the best method based on each individual case. For small wounds with enough healthy skin around them, doctors often use primary closure. This involves stitching the edges of the wound together in a straight line. To make the scar look better, they usually reshape round wounds into an elliptical or football shape before sewing. This helps the scar heal flat and less noticeable over time. However, this method works best when there is enough skin that can be stretched without causing tension or distortion of nearby features. If the wound is larger or in a sensitive area like the nose, lips, or around the eyes, doctors may use local flaps. A flap is a section of healthy skin and tissue that is moved from an adjacent area to cover the wound. Flaps stay connected to their original blood supply, which helps them heal well. There are different types of flaps, including advancement flaps that stretch skin forward, rotation flaps that pivot around a point, and transposition flaps that lift skin over normal tissue. Flaps often give better cosmetic results and help preserve the function of the area. When the wound is very large or there isn't enough nearby healthy skin, a skin graft might be used. A graft involves taking a piece of skin from another part of the body, called the donor site, and placing it over the wound. There are two main types: split-thickness grafts, which include only part of the skin layers, and full-thickness grafts, which include the entire outer layer and some underlying tissue. Full-thickness grafts tend to look and feel more like the original skin but requiring more healing to at both the donor and recipient sites. The grafts are held in place with stitches or special dressings until they establish their own blood supply. In some cases, especially for small or shallow wounds in less visible areas, doctors may leave the wound to heal on its own. This is called secondary intention healing. The body gradually fills in the defect with new tissue, which can take longer and may result in a more noticeable scar. This approach avoids additional surgery but is usually reserved for specific situations. After the wound is closed, proper care is essential for healing. Patients are advised to keep the area clean, follow instructions for changing dressings, and protect the site from sun exposure to help minimize scarring. Watching for signs of infection and contacting the doctor if there are concerns is important. Scars naturally form after any skin surgery, but with good care and sun protection, they tend to fade over time. Choosing the right closure method is a personalized decision made by the surgeon based on the wound's characteristics and the patient's overall health. The main focus is to remove all cancer cells while preserving healthy skin and achieving the best cosmetic and functional outcome. Always consult your healthcare provider for advice tailored to your specific situation. In the context of skin cancer treatment, the aim is to ensure complete removal of the cancer while helping you maintain healthy, functional skin that looks as good as possible.